Well, good afternoon, everyone, and welcome to this webinar, Parent Childcare Preferences, Are They Changing? And these are the highlights from a national survey that BPC has just conducted. My name is Linda Smith, and I am the Director of the Early Childhood Initiative at BPC. For those of you who don't know the Bipartisan Policy Center, we are a Washington, D.C.-based think tank that seeks to take the best ideas from both sides of the aisle to propose and promote public policies that help all Americans. Joining me on this call today is Sarah Tracy. She is the Associate Director of the Bipartisan Policy Center's Early Childhood team. And also behind the scenes, Ben Walters, who is a consultant with us and our expert on the survey itself. So let's go to the first slide. There's a couple of things that I want to make sure that people understand about the survey. As we get into this, you will see that the slides are very dense. To help with this, what we have done is we've already posted the slides and the link is in the chat. So if you want to take a look at those at any point, you can. We will not be answering in this conversation questions on methodology during the presentation, but Ben will be behind the scenes answering questions in the chat if he can, if it's possible to do that. A key point here is, though, is we want to describe the high-level findings of the survey and have enough time to have a serious conversation with our discussants who you will meet later. So we will be moving through these slides quickly. There are a number of them, but Sarah and I have promised each other we are timed and we are going to move through them quickly so that you get the top level information, and then these will set the stage for the conversation that follows. So on this slide, this just looks at the goals of the survey. This survey was conducted in December of this last year, and our goal was to understand the factors that influence parents' childcare decisions, whether or not they're using their ideal arrangements, and measure the trade-offs that parents are making when choosing childcare. And finally, to determine the impact of COVID and the COVID vaccine on future childcare decision-making. So just to note that there's data in this survey that went back and asked parents about questions back in 2020, as well as January 2020, as well as in December of that year. I want to also be sure to thank our partners on this one at Morning Consult, our survey firm, who spent countless hours on helping us figure out these questions and making sure that we had what we needed. So if we can go to the next slide. This just shows you the series of surveys that BPC has done. We started this journey back in October of 2019 when we sought to try to figure out why parents were choosing childcare and if they wanted it closer to home or closer to work. Now we know the answers to those questions, and as we all know in surveys, questions beget questions. And so we've continued to improve and take a look at different things. And you're going to see down the road where we have evolved to in the methodology we use for this survey. So let's go to the next slide, please. Again, the dates and when this survey was conducted. It's important here to note that this survey was conducted of 1,500 parents with children under the age of 5. All parents with children under the age of 5, and we'll try as we go through the findings to distinguish between parents where all available parents were in the workforce and therefore need childcare, as opposed to all parents of children under 5. And there are some distinctions. We'll try to point those out as we move through the data. The other things on this slide, the weighting of the sample or the target sample, et cetera, plus or minus margin of error of 3 percentage points. And just to note that the questions when there were issues of multiple children, we asked the questions of parents' decisions for their youngest child. So if you can move to the next slide, please. This just shows you a little bit of the sort of the profile of the people we surveyed. All of this is actually posted as well. But looking at this in terms of household income, community side, very interesting findings on urban rural issues that we really are seeking to understand the ethnicity and the education levels. Next slide, please. Their employment status, whether or not they were essential workers, the parent answering the survey, as well as their spouse, which was interesting. And then it's important to note that 69% of the parents, as I said, who answered the survey were either a single parent working or a dual, what I call dual working family. So from all those parents, 69% fell into that category. So next slide. Family demographics, we did ask by age of child. I think we're very interested and have been for a while on what's happening with the birth to 3 population. You'll see the numbers of children by category there and the numbers of the families with multiple children. The last survey we did, we also asked some questions around 2-generation families and found that it wasn't giving us enough information that we needed. So we actually got more specific in this one about grandparents living in the home. And where there's a lot more to dig into in this one, but are those grandparents in homes, and are they providing childcare? So go to the next slide, please. The next thing is we looked at who was paying for care of all of the families paying for care. This shows, how many are. I think the thing of note here is how it goes up when it's a single or what I call dual working family. The increase from 45% to 54%. So the 45% is all parents, and the 54% is that narrower group of people with all available families. Still interesting, though, in this one, as is the fact that so many parents are not paying for childcare in this country. And that's borne out in some of what we know of other surveys, Census Bureau, and other data sources that we know about. So next slide. This is where it gets interesting in this area in terms of, as I said, the rural communities and what's going on there, with over half of rural parents not paying for childcare of any kind. And it's something that we're going to probably over the next several weeks dig into more to try and figure out what exactly is going on with the rural population, and is it some of the issues around access and preference and cost. Next slide. I think one of the things that we put this slide in here because I thought it would be of interest to people. It's from another survey that BPC has done to look at the number of women who are leaving the workforce for childcare reasons. And this was done by one of our fellow teams working on the paid leave issue. But we thought we'd put it in here because among women who have left the workforce, 16% are citing caregiving child responsibilities, specifically childcare responsibilities and school closures as the reason they're leaving the workforce. It's a big hit to our economy, and I think that's something that we need to be thinking about. And then obviously more women than men. We've come a ways in this country, but we're not quite there yet. It's not completely equal in terms of who is shouldering the responsibilities for childcare. So next slide, please. So I think what we're going to do next is go to looking at an overview of the findings and some of the significant ones that we asked before we get into to some of the more detailed questions. So let's take a look at the next slide. Operating status. We've been working this specifically around the COVID issue in terms of the operating status of childcare programs. I thought this one was interesting. I'd be interested to those who are watching this if they have thoughts on why this did. If you look at the numbers, about 42% of the programs are still reporting that they are in fact closed either permanently or temporarily. This is a little inconsistent with anecdotal information that we're hearing. We're hearing that more programs are open around the country, higher levels in the 90%. So little interested in why that might be and if people have thoughts on that. And I think this permanently closed issue obviously is of concern to all of us. If you lose 10% of your capacity, that's a significant hit, and it's still undetermined as to how much of that is, if that's going to go up or down. So can we go to the next? One of the things that we thought was interesting in asking this question, in terms of what is closed permanently and what is closed temporarily, with more programs that are located in faith facilities being closed permanently or still closed. And that's an interesting thing, because a significant amount of childcare in this country is in faith-based institutions, whether it's just using their facilities and or actually sponsored and supported by the faith community. Interesting to note that what's going on there, what is going to be the impact of all of that as we begin to rebuild the childcare system. The next thing we wanted to look at, next slide please, was the implications of the vaccine availability in parents' choices. So what are parents going to do, and we've asked this question in the past, what's going to influence their decision to put their children back in childcare? This slide shows that they are considering vaccines as an issue, whether it's everyone in their community vaccinated, their family vaccinated, or childcare workers vaccinated. But significant number want their childcare workers to be vaccinated, and that will influence their decision to return to childcare. So I think if there's one thing, I know we've had a lot of conversations on different chat systems about this issue and whether or not childcare workers are included in sort of the education teacher priorities for getting people vaccines. I think this helps us build the case that in fact we do need to be thinking about getting childcare workers back to work, and that will involve getting them a vaccine. To the next slide, please. This just looks at to what extent parents consider this, depending on what arrangements they would choose, and breaks the other data down more clearly. So obviously, childcare affiliated with faith-based organizations and childcare centers, I think the combination of those two things take the prize with about 27% of the parents, that's a factor for them. 14% for family childcare. Finally, let's go to the next slide, and the one that I think is a little bit of concern to us. In our survey in August, we asked a question about how much parents could afford in terms of looking at childcare. Didn't get as clear of an answer as we wanted, and so we went back in this survey to clarify that, to ask parents by certain income, certain percent, what numbers, put numbers on this, what they could afford. And I think this is one of the things that's extremely alarming to me as I've thought through this. The fact that 2/3 of parents say that the maximum amount they can afford to pay each week is less than $200 a week. If you do the math on that one, that's roughly $10,000 a year. And we all know that we cannot provide high quality childcare on $10,000, in that amount of income coming into these programs. And I was doing the math in terms of looking at the infant care issue on the other end of this scale. And if you look at Washington, D.C., where it's $24,000 a year for infant care, probably less than 8% of the families can afford it. That is a very disturbing thing. And I think it talks to some of the other times where we at BPC have talked about the gap between what parents can afford to pay and what it costs to do it well. So I think we all need to pay attention and focus on that. So next slide. This gets to the affordability issues, and there's a lot of data in here. There's other data. You can pull this out by all of those factors that we showed you early. But it's not a surprise that over a quarter of parents not paying for care reported that they can't afford to pay for it. So if you go back and look at the income breakdowns, and I will say this about this survey, this time we were able to break the incomes down by $20,000 or less, which essentially is poverty in this country. So not a surprise that parents in the lowest income brackets can't afford anything on poverty wages. So what does that mean in terms of their access to care and the quality of care that they might be getting. So the next slide, please. I'm going to now turn it over to Sarah, who's going to walk you through the next section of this and explain, I hope very briefly, the max diff methodology that we use, Sarah. So I'm over to you.
Hi.
Sarah, you're okay.
Okay. If we can go to the next slide, please. So we aim to look to identify why parents are choosing selecting their child care provider at this time. And so to do so, we worked with Morning Consult on the max diff methodology, in which parents were asked to make a series of forced choice responses about the most important and least important factors for selecting their provider. This gets us not only what's most important, but how much more important one factor is over another. I encourage everyone to go and look at the slides at the link in the chat, because at the end of the slide deck, there is some more explanation about this methodology. I'm going to go take a minute to go over these 15 factors that we ask parents to make their decisions on. We included location of child care provider and cost of care. We also broke down different components of quality, including individualized attention provided to each child, reviews and reputation of the provider, accreditation, licensure, quality caregivers and teachers, safety, cleanliness. We also wanted to include things like bilingual educational opportunities, diversity of children and teachers in the program, caregivers who look and or sound like my family, and also approaches to guidance and discipline. And then if we can go to the next slide where we can see the results. Thank you. So we found that safety, cleanliness, prevention of illness is the most important factor to parents, which I don't think is that surprising. However, it was 3 times more important than the average variable, which you can see is that line with a score of 100. Safety, cleanliness, and prevention of illness is also 1.5 more times important than quality caregivers and teachers. On the lower end, you can see caregivers who look and or sound like my family, location of child care provider, and bilingual educational opportunities were less important to families. Next slide. Thank you. We took a deeper dive into who or how parents across demographics were looking at safety, cleanliness, and prevention of illness. We see that they are particularly important to parents with lower educational attainment, lower incomes, parents in the Midwest and in the South. You see these higher numbers there, and also parents in suburban and rural communities. Next slide. There's a lot of information here, so I'm going to, again, I want everyone to look at the slides, but I'm going to go through these very, very quickly. Here we broke out the max diff results by community type. One of the standout findings was suburban communities and rural parents were placing a higher importance on reviews and reputation of the child care provider. And next slide. And then we also broke this out by race and ethnicity. Again, Hispanic families are also placing a higher importance on reviews and reputations of the provider. Next slide. We were able to break this out also by regional differences. The standout for us here was cost of care. Really important to folks in the Midwest, that's above the average utility score of 100, compared to in the Northeast where it's well below. Next slide. And we're also able to break this data out by age of parent's youngest child. Safety, cleanliness, and quality of care were the top. But there's some interesting findings here that I think is worth kind of digging into. There's some variations in opportunities for cognitive development by age and caregivers who look and sound like my family. So that's just a preview. Next slide. So I just threw a lot at everybody, but some other standout findings for us were diversity, while diversity of children and teachers and caregivers who sound and look like my family are kind of on the lower end of importance for across all parents. These factors are more important in urban communities than other community types. Similarly, caregivers who look and sound like my family was more important to parents in the Northeast. Something we didn't really talk about yet, but opportunities for social emotional learning as a factor was important to parents in urban communities, more important than in other community types. And then cost of care is more important to parents in rural communities than parents in suburban and urban communities. We can go to the next slide, please. And then the next one, we're going to talk about what we found with childcare arrangements. If we can go to the next slide. Childcare arrangements during COVID-19. This is across all parents. We're finding there's an uptick in parents who are providing care for their children from 23% to 29%. This also, in this survey, we were able to break out centers by faith-based centers versus centers not affiliated with faith-based program. And we can see here there's pretty consistent use of faith-based centers among parents from 13% to 12%. Another thing that I want to point out is that relative care is used at 9%, and then a slight decrease to 7%, which we may attribute to health considerations. But non-relative friend or neighbor care is not used that often. It's at 2%. And I think that will be a conversation we may have with the panelists about how we navigate this FFN, family, friend, and neighbor care. Let's go to the next slide, please. This is the same data among all parents broken out by income. Here we see parents with income less than $75,000 are providing care for their young children. This is consistent really with what we've seen in January and during COVID. And then higher income families are likely to use faith-based programs. Next slide. This is the same. This is the data broken out by race and ethnicity. Here we see across all racial groups the use of providing care for their parents are providing care for their children, and there's Hispanic families are showing higher rates of using faith-based centers. Go to the next slide, please. Here it's broken out by community type. Rural and suburban communities are providing care for their children at higher rates, and then parents in urban communities are using faith-based centers, and that's again consistent with what we saw in January. And next slide. And so that was what was current and compared to what was in January. And now we're looking at the ideal childcare arrangements. So we asked parents if all arrangements were equally priced and equally accessible for your family, what is the ideal arrangement? And pretty consistently in January and during COVID, we see that parents want to provide care for their young children. Again, this was among all parents. And the next ideal for parents was centers. Going back down to the non-relative friend or neighbor care, we see that it is neither being used as much, but it's also not an ideal arrangement for parents. Next slide. This data is for parents paying for childcare in January 2020. They said their ideal arrangements were centers. There is an uptick from January to during COVID of wanting to provide care for their own children. Next slide. This data goes back to all parents. It is broken out by income level. It is fairly consistent with what we saw the current arrangements. Families with income under $75,000 want to provide care for their children, and families with an income over $75,000 their ideal arrangement. 23% said faith-based center, and then 15% said a child care center that's not affiliated with a faith-based program. Next slide. This data here is broken out by community type, pretty consistent again with what we saw as the current, but more rural families are wanting to provide care for their children now during COVID. And next slide. And this is my last slide. Here we look across current childcare providers that people are using now compared to their ideal. And this is what we're finding across these parents, is that about 3/4 who are using a faith-based center, 3/4 are using relative care, and who are providing care for their young children are currently in their ideal arrangements. There's a lot more to dig into this, and I look forward to a discussion. So I'm going to pass it back over to Linda.
Okay, go to the next slide, please. And thanks, Sarah. So now we're going to take a very quick look at their preferences in the important factors, and some of these will look like they overlap, but I want to point out a few things on this. So if we go to the first slide, I think that what we see that parents repeatedly prioritize cleanliness, prevention of illness, trust, etc., as their highest priority. And, we have heard this over and over and over again in the work that we've been doing with parents around the country. Those two things, health and safety, cleanliness, trust is a big word when you ask parents what they're looking for. I think of note on this slide is the fact that quality of caregivers and teachers, the percentages that are there, but also important to parents right up there in this is after this cost of care issue is flexibility of the program hours and how important that is to providers or to parents when they look for care. Going on to the next one, cleanliness, interestingly, and the disease prevention and the cleanliness and the safety issues are more important to lower income families. And I've tried to think that through a little bit. We have some thoughts on that, but interested in looking again at the data, especially by some of these income categories. If you go on to the next one, back to the rural issue again, this is where it gets interesting, because if you go back to the number who are not paying for care, and then you look at this at cost of care as an important factor, there's a lot more that we need to think about in rural America in terms of this whole issue of cost and what parents can afford to pay. The next slide looks at where parents are compromising, and I think that this is also something. It gets back to some of the conversations about what are parents willing to say and admit. But 1/3 of parents reported that they did not make any compromises when they selected their child care arrangement, which was interesting because if you look at all the variables here. However, that said, nearly 1/4 did say that the cost of care and the flexibility of the hours, they had to compromise on those things. And so I think that's something that needs to be taken seriously as we move forward, and that suburban and rural parents are twice as likely as urban parents to say that they did not make any compromises. I think that, again, is another interesting thing to dig into in all of this data. So now I want to just say that we're going to move on to the next slide and start talking about what we think are some of the big top lines out of this and set up our discussion to follow. So next slide. I think the highlights that we've been trying to think through here are that 2/3 of parents cannot afford the cost of high quality care. And I think that we all know that now. I think we have a little bit more data to help us on that one in terms of just how many people are essentially not or locked out of high quality care. The faith-based childcare issue is, I think, an important component of childcare for parents, and we need to think carefully about how we are bringing the faith community into this conversation in a meaningful way, and that we have thought through this, sort of how we build a better and a more comprehensive system with that community. I think the next thing that the majority of parents, again, as I just said, do not feel they are compromising on their choice of care. I want to put plug in for this one, because some of you know me, have heard me talk about this. I have said for many years that we need to stop saying FFN as a category of care, that family is different than friends and neighbors, and we need to understand the differences. As Sarah pointed out, the percentages of parents really using friends and neighbors is very small, and it has been consistently in our surveys. Less 2 to 3% of all parents are using that, and or prefer it. And then finally, the vaccines and the importance of them to our community and to parents as we struggle out of the situation that we're in right now. So now I'm going to close out this piece and go to the panel that we have. And I want to introduce our panel quickly, and then we have a couple of questions, noting that we will take a few questions towards the end of this. So if you have questions, put them in the chat, and we'll try to get to a few of them. If we don't get to the questions, we are going to plan on capturing those questions, and we'll try to make the answers clear. Because as I said, there's so much in the data behind what you just saw. It's almost mind-boggling. So first, I want to introduce Heidi Hagel-Braid, who is the Chief Program Officer at First Children's Finance in Minnesota. Heidi brings years of experience. She's been at the First Children's Finance for a number of years, but she works specifically on rural child care issues and especially a child care innovation program that she established after she came to Children's Finance. So we wanted her to come in and be thinking particularly about what we're seeing on the rural issues. Next is Kara Waddell, who is the president of Child Care Associates in Fort Worth, Texas. And Kara, besides bringing her experience of the organization she runs, which is a vast organization that does provide subsidies, administers a subsidy program, I think is one of the more innovative thinkers in the business and how are we going to manage and help our the supply of childcare in this country. And finally, Suzanne Morris, who is a fellow with us here at BPC. She's been with us about 2 years now at BPC and comes to us as the former Deputy Secretary for Pennsylvania's Office of Early Learning and Child Development. And so she brings a lot of experience and also some work that was done there, not only on the workforce, but on the non-traditional hours of care issue. So I'm going to open it up, and I have one question I want to ask each one of you, and then we'll get into more questions for all of you. I want to start with Suzanne, because you've worked at the state level, Suzanne. Well, in that role, describe that work that you did a little bit on non-traditional hours of care. What did you learn? And what can state administrators do, given the high priority and the issues around parents and the flexibility issue? What can they do to be more supportive of flexible hours of care? And I think at another point, Kara, I know Kara's doing some work on this as well, so I will flip and ask Kara to describe some of what she's doing. But Suzanne, let's start with you on this one.
Yeah, thanks for asking the question, Linda, because I think that this issue is more pressing now than ever. And so in Pennsylvania, what we did is we partnered with philanthropy to do a pretty rigorous study looking at multiple regions in Pennsylvania of what the needs were for parents in terms of non-traditional hour care and how those needs were being met. And what we found was what I think you would expect, is that their needs were not being met at all in terms of needing evening care, weekend care, and flexible hours across multiple days. So we took those data and pulled them apart and had a deep internal conversation, and moving forward and thinking about how states can support these needs, it really does come down to having, in my perspective, a local state partnership. It's very challenging to move forward with broad policies that meet across the board needs without understanding directly what communities need and want while talking to parents. And so we developed relationships with the local workforce development boards to really understand what their folks that they were working with that were working in these non-traditional hours, how they were being respected within terms of getting care within their communities. And then I think for all states, and this is probably a no-brainer. You need to start to turn the data into policy and practice and start to push initiatives forward that make flexible hour care something that's sellable to the childcare community and that they really want to participate in and feel supported in, as well as regulations. I think regulations are something that need to be looked at very closely when it comes to flexible care at the state level and how it's meeting the needs of both families and their children, as well as childcare providers. Are they able to understand, and are they being well supported with meeting health and safety standards in unusual hours? And so that's the conversation that we had in Pennsylvania, and really was able to help us think through what the workforce needs were at that time.
Kara, can you add to that? Because I know you're doing some interesting things with trying to figure out how to do a better job of scheduling, especially, and getting at the flexibility issues when parents don't need just 7 to 6 care every day.
Yeah, absolutely. I think on the ground, we, during the COVID crisis, when it first hit, we knew, okay, the need for childcare just fell off the planet. And the real question we had at the local level and working with our mayor and our businesses in our community was, how quickly will the demand for childcare come back? And then what will that look like? And we did a publication that we put out just asking that question: will childcare survive 2021? And when it in that survival mode, parent preferences may be changing. That was our question. We believe that the new way of childcare is going to look, once we have a vaccine, may be very different than what we had before we ever experienced COVID. And we've been hearing that from families and beginning to have these conversations with childcare providers pre-vaccine. And how are you going to market yourself? And I think this survey brings really powerful examples of: walk through your centers, show them the health and safety needs, help parents understand, if they are looking for care, why that may be a great choice for them. Then you also have a really interesting look at post-vaccine. What's this going to mean for childcare businesses on the ground? And we've been asking questions. What we continue to hear from women is that now that they've been working from home, men have been working from home, they have a preference in taking care of their own children at least part of the time. They may not come back to 5 days a week, full-time care. And businesses on the ground are going to have to really stop and rethink, what's my business model based on what families really need.
Mm-hmm. And following on to that, Kara, would you, I think because you're on the ground and working with families, I'd like to hear your thoughts on what the survey data showed about the preferences and the compromises that parents are making in their choices of childcare. How does that compute with what you see at the local level? And any thoughts that you have about that?
Great question. And I think the challenge that I think a lot of people are looking at is specifically women, that if women were working outside the home before, what is that going to look like in the new world? And we're seeing what the survey showed us, especially if you added up the spouse taking care of children, the mother taking care of children, and you looked at that total, I think it was 28%. A huge preference. The number one preference for care is going to be to you or relative taking care of the child themselves. Huge implications for businesses. I know in our community, we have a Best Place for Working Parents initiative that we started, which is engaging our corporate community, small business, medium, and large, and starting to say, how are you going to support the working parents in your own community? And it was also a huge shock for us to see from the survey about faith-based programs. A lot of times we didn't think that was a huge preference, and it showed up, I think, as number 2 among parent preferences. And so it's going to be a very different world on the ground locally, as we know that consumer behavior is really difficult to change. And now that parents are buying their groceries online, right? They're not going to the grocery store anymore. They're working from home. What's that going to look like as it relates to caring for their own children, especially younger children, is kind of the net we all have to crack. And certainly business owners are going to have to really rethink what that looks like.
Mm-hmm. Interesting. Heidi, you do a lot of work in the rural parts of Minnesota, I think South Dakota, and some other states in the West and Midwest. What was your reaction to some of these questions, some of these findings on rural issues? Some of them, I'm from rural America, and some of them really surprised me when it comes to, the number of the parent choice issue and some of the cost issues.
I don't think there were that many surprises, actually. As we look at the results of your morning consult survey and put that against other sets of data, I think one of the things to consider is the rate of women participating in the workforce. And although in the upper Midwest that is exceptionally high, we also have to think about what COVID and working moms are experiencing, how their work is going to change, where it's going to happen, and the ability of folks in rural to be able to work remotely. Broadband issues are always ongoing. We are also wrestling with the availability of quality facilities in rural where childcare can happen. So I guess I wasn't super surprised for the preference for faith-based uh, programming for early care and education, because that's a lot of the most viable facilities in both rural and urban communities, but specifically in rural communities. I think there's a lot to think about also around the cost of care. When we do this work in rural communities across the upper Midwest, we hear a lot of stories of, in particular, moms opting out of the workforce or being underemployed. We hear a lot of stories of firefighters working one shift, nurses working another, so that they're not opting into childcare because they simply can't afford it. So, although it is shocking, having been working in rural communities now since 2013, there weren't that many surprises, but we do have challenges to address.
I think that's really interesting. It kind of plays into the question I want to ask all of you, because as you heard me say, I've been on this drumbeat for a number of years in terms of separating this issue of family versus friend and neighbor care. And I think the data is pretty clear in the surveys, all of the surveys we've done, that the preference is for family or relative care versus friends and neighbors. And they're completely different in my head. And so I just want to understand your thoughts on these things and the implications for future policy. Where do we go with this thinking about parents preferring family members or relatives? And Carol, why don't we start with you?
I'm going to lean in a little bit to, again, the idea of what this means in the workplace and for employers. If, especially women, but if parents are showing a preference to, maybe it's not 5 days a week, but a few days a week, taking care of their own children, what does that mean? What are the kinds of supports and policies? It doesn't necessarily mean putting a childcare program in that building where they may work. It may mean giving different flexibilities and flexible work hours, and supporting not only the mother with policies to have time off, but the father with time to spend time with the children. So when I hear about family as a significant piece, I think it's a great problem for our business community to help look at as well, that they want women in leadership, they're wanting women in the workplace, and families in the workplace with young children. They may have to really ask some tough questions.
Mm-hmm. Suzanne, what do you think about this one and looking across the work that you did in Pennsylvania?
So I think that it's time for a really deep philosophical question around how states are talking about childcare and how they're defining it, and the respect that they give to parental choice. And I don't think that that necessarily means that it's a blanket policy statement, but to be able to have an honest conversation that if families want to have their children at home, that's a choice that state administrators and all their partners have to respect and find a way to weave that into the conversation, and then the policies and practices that support the childcare market at large. And I don't know if everyone's ready for that. I'm going to be honest. But it is something that clearly needs to happen. The data are showing it. We're all probably experiencing it in some fashion in our homes and communities, each of us on this panel. So I think it's just time. It's a very modern update for the conversations that happen at the state level.
Mm-hmm. And finally, Heidi, how about you in the rural areas?
I think I agree with Suzanne that it is time for a public policy conversation. For decades, we've been struggling with availability and supply of care for infants and toddlers. And this is certainly part of a solution and honoring parent choice. But I also think that we need to track what is going to happen post-COVID pandemic to see what happens with working families, particularly women, to see what workplaces look like, what labor force participation looks like. And we may see those preferences shift once again. It's really hard to pull out a global pandemic from what your highest preference is in the current state of affairs. So I think it's important to track over time and see if we see shifts in longitudinal data.
Mm-hmm. Yeah, I do think that there's a lot of unknowns as we move forward on some of these things. I have another question about we all care about and are concerned about the childcare workforce. And I think that there's a lot of, ambiguities about what's going on and where are we going to go with this one? How many of them are we losing? What's the quality of them, et cetera? I think it was heartening to see that the quality of the workforce scored as highly as it did. I think that was a good sign that parents are seeming to care about that. But as we get through this, what do you think are going to be the challenges of getting back our workforce, recruiting and improving our workforce? And how do we move forward to support a workforce that's really suffered under the last 9 to 12 months as they lost jobs and had to make do? Anybody have thoughts on that? I guess we could start, Heidi, with you.
Sure. I think it's very clear that we need additional investment from both the federal and state government. We looked at the data that said the cost of care is out of reach. Most of the costs associated with the price of that care is wrapped up in personnel. And let's be clear, people in this industry are not making a lot of money. In fact, these are not, livable wages in many parts of the country. So we need additional investment at both system levels to be able to start to chip away at this problem. We need new and different money secured so that we can enact policy and programs and sustainable funding mechanisms to address this issue.
Mm-hmm. Suzanne, how about you on this one?
I wholeheartedly agree with Heidi, and I would add to that, I think we need real structural supports to ensure that the teachers and all of the support staff, the directors, are getting what folks in most other jobs get. They need benefits, they need time off, they need accessible and affordable higher education and professional development opportunities, because these are real careers and they're jobs that people want to stay in. And I also think we're going to need to have a real conversation about the quality and nature of the work and the types of wraparound mental health and classroom supports that teachers are getting, because they've stayed on the front lines for us. And we need to make sure and ensure that they're healthy too along the whole way. So I think that's something we can look at in terms of, in addition to the investments that are being made, is what are the structures that these teachers and everyone else can access.
You did a lot of work in Pennsylvania on the apprenticeship model. How do you think that plays into the future of what we need to do?
I think it's one of multiple career pathways we have to think about. I think apprenticeships have an enormous promise for the early childhood field and can really help those that are in the beginning of their career or those that are somewhat along in their career pathway. But I think we need multiple options in addition to the apprenticeships. So we need to look at the professional development system as a whole, and not only how it's funded, but also how that funding is getting to individual teachers. And so I think there's a lot of concern that certified teachers are going to get snapped up by the K-12 system, which is under a lot of duress right now too. And in thinking about how we keep those teachers that have enormous skill, whether it's years of skill or it's skill acquired in a higher education classroom, is going to be the most pressing question in the immediate future for a lot of our childcare programs.
Heidi, what do you think about this in rural America? Because you brought up the broadband issue and some of those things. Getting professional development out there in rural America has got to be a challenge.
Absolutely. That it's the systems that would support professional development just are really stretched or non-existent in many rural communities. So, public-private partnerships are something that in our rural work we've been building. How do you look at local employers, the public sector, to be able to create some patchwork solutions to meet those challenges? But there's no doubt that we need comprehensive systems that are going to address access of the workforce to some of these supports. It's not only just building the opportunity, but creating access that makes sure that everyone can get into those opportunities to deepen or broaden their professional development, to have access to apprenticeships. There are significant challenges in making this scalable in rural communities. They are not so great that we can't overcome them, but you really have to shift the mindset out of a metrocentric point of view, thinking about how you can create access broadly in communities where they don't have access to public transportation. Higher education systems are much smaller, and the scalability of those issues really need the innovation and creative thinking that rural communities have. You're going to have to borrow from other industries about how they've solved these issues, and borrow some of the really good ideas and replicate them for rural communities.
Just really quickly, what other industries do you have in mind when you say borrow from other industries? Are there things that stand out?
I think one of the things that stands out to me is manufacturing. You will see, the trades have done a really good job of securing public dollars to create apprenticeships and pathways and ways in which the corporate sector and the public sector are investing in efforts to build their own workforce. I think there's some good lessons to be learned there.
We're running out of time, and we do have a couple of questions in the chat here. That one, someone asked if we were surprised to see that location was so low on the list. We weren't at BPC because we had surveyed that last fall and found that, parents, generally want it close to home versus close to work, etc. Did that surprise any of you guys? That location wasn't an issue? No. Okay. There's another one here in the chat that asks, and I don't know that we have the data on this, but there's a question about if parents have access to public pre-K or other free programs, sort of what is that? What is the impact of that? And we didn't ask that question specifically, but I don't know if any of you have thoughts on the impact of pre-K on some of these childcare decisions that parents are making. Anybody want to comment on that?
Initially, oh, sorry.
Okay.
I know initially in Texas, we've seen a 22% drop in pre-kindergarten participation this year. And so we're hearing from families, they don't want to send their very young children to great big schools. And so I think there's some implications as we start looking at our preschool aged, maybe a community-based delivery system is something that we also need to look at. And when we have community-based pre-K in addition to school-based pre-K, but we have seen parents shy to take advantage of pre-kindergarten because they seem to be valuing those health and safety questions. Post-vaccine that's the $1 million question in our state is what's going to happen post-vaccine? Are parents going to go back to pre-K? Our theory is maybe they're going to come back to pre-K, but they're going to be interested. The younger go, we see lower participations in big programs. And so we think that families are beginning to show infants and young ones, they like to keep at home, and maybe a little bit older, they're willing to put in a small program, but we're not sure they're going to be running back into the elementary school as quickly as before.
Anybody else on that one? I'm sorry, what, Sarah?
I don't know if you can hear me. The data that we showed with comparing the current versus the ideal arrangement, 40% only 40% of those in Part Day pre-K programs said that that was their ideal arrangement. So that is a piece of data we could pull out.
Okay, good to know. There's another question here in terms of, it says, are moms really saying they want to care for their children at home, or have they just been forced into that through COVID? That result is surprising. That's been pretty consistent over our survey work, so it wasn't surprising to us. We've been seeing that now since we started doing this work on the number of moms who say they really do prefer to be either their own family caring for their children, or relatives. I think we're running out of time here now, and we just have a couple of quick minutes. You all have had a chance to look at this data more than most that have been watching this. We're always looking for advice. I'm going to put you on the spot in terms of moving forward. What still needs to be looked at? What don't you know about parents that you think we still need to try and figure out? And I know that's a little bit of a surprise, but hopefully you can give us a little bit of advice on this. So Heidi, why don't we start with you?
Sure. I think related to that question that was just asked, I think one of the things to continue to consider and research is, what do people want and what do they do? Because I think that's a very loaded question. It's a hard one to answer. It's a hard one to ask even. What are your preferences? And then also, what are you doing instead? And I think we really have to look at the labor rate participation for women, especially younger women. It's hard to break down that number that we see from the federal government. So let's look at younger women who are the mothers of those young children to see what they're actually doing and whether that is matched up with their preference or not.
Mm-hmm. Kara, what advice do you have for us?
I continue to wonder just about what the return will look like. And are there models versus what parents are seeing today? Are there models that really would attract them to utilizing care a little bit outside the home or helping women perhaps return to the workplace in different ways? Those are questions that certainly our community is asking.
Mm-hmm. Yeah, we've been trying to do a little bit more on the women's side of the issue, and I do think that there's a lot of interest right now here in Washington on the impact of COVID, in particular on women and women's participation in the workforce. And we see that not only with our own workforce, the childcare workforce, but across the board. And I think one of the things that we've been struggling with is the length of time it's going to take. Kara, to your point, the length of time is going to take us to really what is going to be, I hate the term new normal, but we have to use it. What is going to be the new normal here, and how long is it going to take us to fully get to something, where we're settled down after COVID? And I think those are really serious questions that are a lot of unknowns. And so we're struggling with that. Suzanne, do you have any final thoughts on this?
Just as we continue to learn about what parents want and move into this new normal, it's of great interest to me to know what moms and dads that would really like to stay home with their children or have their children at home with a relative, what types of supports they would need to make that experience valuable for their children. It's a little hard, I think, for all of us to unpack whether this is a reactionary response to how the world is right now, or if it's as we move into it and start to see people settle into that, and that's something they really want. I do think parents are going to need and want to have external supports or some sort of wraparound. And I'd really like to know what that looks like to them, what would be meaningful and valuable.
Mm-hmm. Yeah, I think all of those are good comments. And I think what I would ask of the audience who's been listening to this conversation is to share with us your ideas on what else do we need to know. I think for those of you who are listening, all of this information will be posted on our website at BPC, the Bipartisan Policy Center / early education childcare. And all of the data is up there, the crosstabs, everything to do. And as you look at it, please share your ideas and your questions. We are seriously trying to figure this out. And I think to everyone's point, what we're trying to figure out is what is the balance between what parents need and what our child care provider population needs. And there has to be a balance in these two things. One recognizing sort of the urgency and the needs of the other. So with that, I think we're running out of time here. I do want to thank everyone, and especially our discussants, Heidi, Kara, and Suzanne, so much for this. We appreciate your thoughts and hope that we can continue this conversation down the road. So again, everything is posted. Share with us any questions you have or thoughts as we move forward. Special thanks to Sarah and Ben and the folks at Morning Consult for all the work on this. This one was a labor of love for a lot of people. So hopefully everyone out there in the country can get something out of this. So thank you all, and everyone have a great day.